Ladies and gentlemen, hello, and you are watching TTV News, some latest events in the province. And now we come into details. Ladies and gentlemen, Duong Minh Chau District administered the third dose of COVID-19 vaccine for the frontline forces fighting against the pandemic in the afternoon of November 29, 2021 at the campus of the District People Committee. The district established the third dose vaccination plan based on the current state of epidemic prevention and control in the community, and the objective of enhancing rotation of high-risk groups. Furthermore, the quick spread of the Delta variation and the discovery of the new Omicron trends raise concern about the possibility of another epidemic. The subjects who received the third doses of vaccine are members of the Steering Committee for Epidemic Prevention and Control at all levels, people working in the isolation areas, on duty of tracing, epidemiological investigation of community COVID-19 teams, volunteer reporters, military forces, police, teacher, officer, and employees of agency sector mass organization, subject in the department and branches directly in contact with citizens. In addition to the injection point in the district, the anti-epidemic forces at the routes will be adjusted at the commune and townhouse station. The vaccine distributed for injection is Pfizer-BioNTech. Faced with the complicated situation of the COVID-19 pandemic, the number of F0 cases is increasing. In order to join hands to support the health sector in epidemic prevention and control, the People's Committee of Ward 3, TayNinhTV, launched the Accompanying F0 model in the new normal in the morning of November 29.
The model is launched to create favorable conditions for people infected with COVID-19 to receive comprehensive care in terms of physical, mental, and material care, not to make people infected with COVID-19 feel stigmatized, and finally to raise awareness, consciousness, attitudes, and responsibilities of people and society regarding COVID-19 epidemic prevention and control. On this occasion, the Ward 3 People's Committee also established a rapid response team comprised of union members, youth, and local militia to assist with suspected COVID-19 infections. When receiving suspected infections, the rapid response team will assist in completing medical isolation records at home, testing and screening, buying essential goods during the isolation period when family circumstances are difficult. At the same time, visit and guide the use of COVID-19 medicine just as required.
The Ministry of Agriculture and Rural Development hosted an online conference on high-level policy dialogue transforming to a real, low emissions food system on November 30. Mr. Lê Minh Hoàng, Minister of Agriculture and Rural Development, presided over the meeting. At the report, the conference was attended by Mr. Trần Văn Chiến, Vice Chairman of the Rongsor People Committee, leaders of the Department of Agriculture and Rural Development, leaders of the People Committees of District, Town, City, and representatives of agricultural enterprise and association in the province. Delivering his opening speech, Minister Lê Minh Hoàng emphasized that in the context of the COVID-19 pandemic, with the role of the support of the economy, the transition to the new agricultural model becomes an urgent and necessary requirement. The government has released a national plan on green growth for the period 2021-2030, which is presently being implemented by the Ministry of Agriculture and Rural Development, with the objective of reorganization the agricultural sector. Rural economic growth, which is linked to model rural congestion, is built on three pillars: ecological agriculture, modern countryside, and smart farmers. The agriculture industry likewise recognizes the need to shift from production thinking to economic thinking, with the focus on green values derived from green transformation, green consumption, and green economy. At the conference, with the participation of the representation and discussions of agricultural experts from around the world, most of them supported Vietnam policy and views on the transition to a green food and food system and the development of a green food system, low emission. This board also shared with Vietnam about new model, good practice, as well as lessons learned from countries around the world. However, in order to transform a change, the agriculture sector cannot stand alone, but need the sharing, companionship, support of ministry, central agency, branches, and locality, as well as organizations and individuals at home and abroad. Thanks to the effective implementation of the plan to restore production in the context of the COVID-19 pandemic, the province industrial production index in November increased by more than 9% compared to the previous month. Some industries had high growth indexes, such as the mining industry, which increased by more than 30.9%, the processing and manufacturing industry, which increased by more than 8.9%, electric and gas production and distribution, which increased by more than 7.9%, and the water supply industry, which increased by more than 20.5%. From the beginning of the September until now, TayNinhTV has actively social distancing, implemented a strategic shift, self-adaptation, flexibility, and effective control of the COVID-19 pandemic in order to gradually reopen the country, the economy, transitioning to the new normal. By mid-November 2021, in the province, there were 238 businesses returning to operation after the distance, with a total number 116,950 employees. Most businesses have converted to the one road to destination option by personal means, with a total workforce of more than 106,915 people.
Currently, at the April 30th Park City, there are many cars and trucks that encroach upon the sidewalk and are parked in the wrong place, adversely affecting the urban beauty. The park is known as an entertainment and exercise place for many people in the city. The April 30th Park Management Board has preserved a part of the sidewalk located on the Buster Street and divided into a yellow line to make it easier for people to come to the amusement park with car parking and ensure a safe distance. But it's worth mentioning that recently the situation of many vehicles in the wrong places. Arbitrary parking is quite common at the April 30th Park, causing inconvenience to adults and children when they need to go to the park to play and exercise, but also quickly damage the pavement and obscure propaganda posters. In the face of this situation, it hopes that TayNinhTV functional forces will regularly patrol, remind, and strictly handle the illegal parking situation that still exists and return the urban beauty to the city.
Ladies and gentlemen, the situation of the COVID-19 epidemic in TayNinhTV province is complicated. The FOs are releasing rapidly inside the COVID-19 treatment hospitals. The doctors are currently working at 100% of their strength. The fight against COVID-19 has never been as difficult as it is now. Accompanying Hospital, which has been discontinued, has now been converted into Field Hospital number 5 for the treatment of COVID-19 patients. Currently, the hospital has more than 100% patients and continue to receive patients daily, while the staff on duty only has 3 doctors, 6 nurses, and 1 radiologist. Doctors are working with great pressure. Meanwhile, the old hospital facility have deteriorated. Many areas are unusable. Every time they see a patient, the doctor and nurses have to walk up and down 3 floors because the elevator has stopped working. Patient and doctor become each other relatives. Doctor encourage patient encourage doctor and nurse to overcome difficulties together. Every day, the team is on duty, take care of patients from 6 a.m. to late at night and usually make medical record in the middle of the night or 1-2 a.m.
There are too many patients. All of them are seriously ill and old. We try to reassure the patient, try to take good care. People see and they help us. They clean the house, pick up trash. They help all the time.
I have been here for 4 days. At first, he had no oxygen in his blood. He was around 92. He was very tired. He couldn't breathe. He went to the doctor to give him oxygen. He just cut off the oxygen at noon. The doctor is very hardworking. The doctor was very miserable. Love doctor very much.
My son has severe symptoms. I came here. I see the doctor doing his best, overloaded, enthusiastic. I try to help the doctor. The patient kept listening. We love the doctor so much.
For months, the doctor and staff working at the field hospital has worked with great intensity. While the income is still the same as before, all the support regions are not available. If there was no love for job and people, many people would have given. especially in difficult and stressful working conditions like at Field Hospital number 5. Meanwhile, the Tuberculosis and Lung Disease Hospital is the hospital with the best COVID-19 treatment facility in the hospital subcontinent province. The hospital was originally designed to prevent infection, so the treatment areas are more spacious than other hospitals. However, the doctor working here also face a lot of pressure, with the focus on caring for and treating patients with the severe symptoms. And the number of hospitalized patients continuously increasing. Doctor and medical staff have devoted all their energy and time to patient care.
There are many patients, lack of human resources, and a lot of pressure. The consultation lines are continuous, with more than 10 to 50 cases per day. All of the patients are seriously ill, and many of them are in critical condition. The patients are very sick, but the human resources are not enough, so the care, especially the nurses taking care of them, is very long. Until the time of rest, they can't eat.
Doctors and patients both overcome themselves in the battle with the COVID-19 disease. The more choice when the dedication of the doctor has helped the patient to recover step by step. Currently, our treatment hospitals are overloaded with the number of patients. Doctors many have to work more if the number of patients increases.
Everyone has a family, so everyone is afraid. No worries for themselves, but fear of infecting their family and society. We will try our best to serve patients. Everyone at home, rest assured, and we are on the front line. Everyone must take care of their health so that they don't go to the hospital. Just stay at home better than stay in the hospital.
Ladies and gentlemen, that's all for today TTV News. Thank you for joining with us and see you next time.